Good evening. Welcome to the 2025 Living Legends Celebration. Please give a warm welcome to Academy President Linda Scott and Chair of the Development Committee, Larry Slater.
It is truly enchanting to see the ballroom transform like this for our first evening of recognition and honor. Here we gather to recognize this year's 6 living legends and 4 of the annual award recipients. However, before we do, I am thrilled to be able to introduce a new recognition of 5 generous donors. In 2024, the Development Committee thoughtfully explored how the Academy could elevate and enhance donor recognition. One of the ways the committee believed our organization could do this was by revisiting and revamping the structure of the Academy's giving levels. In doing so, it was revealed that we have a cadre of supporters whose philanthropic efforts empower the Academy to lead in policy, science, innovation, and leadership. I would like to thank you, Dr. Slater, Chair of the Development Committee, for helping to shepherd this initiative to ensure our donor recognition reflects the honorific nature of our fellowship. At the highest level of giving is the Transformation Society, which includes donors who have contributed $100,000 or more to the Academy since 2001. This evening, and I think you want to hear this, this evening, it is my honor to recognize 4 individuals and 1 organization for their entrance into the Transformation Society. Dr. Karen Cox, Dr. Jerry Milstead, Dr. Linda Burns Bolton, and Ms. Janine Rivet, and the Rita and Alex Hillman Foundation. On behalf of the Academy, I extend our deepest gratitude for your unwavering commitment to our mission and your extraordinary generosity. 2 of our honorees will be here tonight and will share their reasons for why, out of the many causes they could support, they chose the Academy. In addition, a dear friend and colleague will provide accolades on behalf of 1 honoree in memoriam. First, I would like to recognize Dr. Karen Cox, President of Chamberlain University. Dr. Cox served as President of the Academy from 2017 to 2019. Dr. Cox, will you please join us on stage?
Good evening, everyone. Well, in 2005, exactly 20 years ago, I was inducted as a fellow. And the world of professional membership was not a new one to me, as I had been involved in a number of organizations. And yet, in the Academy, I found a camaraderie of experts unlike what I have experienced before. So I made the decision to invest in the Academy going forward. And this meant most of my time, treasure, and talent. I believe over these last 20 years, I have fulfilled the time and treasure. I will let others decide on the talent. But I give to the Academy because it's not an organization focused solely on the nursing profession, but how we collectively use our knowledge to impact policy and improve patient outcomes at all levels. I believe that through this organization, made up of many of the top leaders in our profession across all sectors, we have and will continue to significantly impact the health of the public. And that, fellows, is a very worthwhile cause. Thank you.
Thank you, Dr. Cox. Your words were truly inspiring, and we are deeply grateful for the insight you have shared about your dedication to the Academy and its mission. You embody the commitment of time, talent, and treasure. It is now my privilege to welcome another remarkable leader, Dr. Jerry Milstead. Dr. Milstead provided a transformational gift in 2022, coinciding with the commencement of the Academy's 50th anniversary arc.
Good evening. I've been asked to say a few words about philanthropy and why I have contributed and continue to contribute to the Academy. Every nurse in this room has a story of struggle, of frustration, of joy. We've advocated fiercely for our patients. We've challenged systems that often felt immovable. Through it all, we've learned that if we want lasting change, we must shape it at the policy level. The American Academy of Nursing expresses our voice to policymakers with power, inclusivity, and collaboration. When you read the annual report, you'll recognize that when the Congress on Nursing Research, CANS, meets with the NIH director to discuss funding priorities, we are there. When edge runners implement their innovative, successful programs in every corner of this nation, we are there. When invited by NIH to comment on ethical principles, cybersecurity, biomedical and biochemical and biobehavioral research related to AI, we are there. And when the Academy itself re-envisions itself to better serve its members and amplify our policy impact through our collective voice, we are there. This organization is effective in influencing government policy because it engages and educates members, partners, and policymakers on issues relevant to the profession and the health of the public. I contribute because I believe in the Academy's power to shape policy, to elevate science, and to build a future where nurses lead. Whether you contribute a lump sum, serial donations, or a deferred gift through your will, I hope that you will join me, not just in giving, but in investing in the legacy we are creating together. Thank you. All right.
Thank you, Dr. Milstead. Your reflections remind us how fortunate we are to have your vision, leadership, and unwavering support within the Academy. Now, it is with a bittersweet feeling that I honor Dr. Linda Burns Bolton. I know many of us in this room were inspired by her leadership and wisdom, and we continue to celebrate her legacy. Dr. Burns Bolton was president of the Academy from 2005 to 2007 and became a living legend in 2016. This evening, her dear friend, Dr. Alicia Georges, who also serves on the Development Committee, will share remarks in her honor. Dr. Georges, would you please join us on stage?
President Dr. Linda Scott, Dr. Miyamoto, CEO, President-elect Dr. Barksdale, esteemed members of the Board of Directors, thank you for asking me to speak on behalf of Dr. Linda Burns Bolton. I promise not to cry, but Linda was my friend for about 50 years. Her caring about others and how she could help them to achieve what they wanted was evident from the first day I met Linda. I want you to know she embraced and nurtured those who were striving to become nurses, and many times helped them financially without anyone knowing. She supported those building careers in nursing. Ask anyone at the Civitas Sinai health systems about Linda Burns Bolton, where she spent her entire nursing career. So her willingness to move the profession of nursing forward in building nursing science, nursing practice, and nursing research, policy development, leadership in nursing, and other health-related organizations was one of the reasons Linda gave so generously to the Academy of Nursing, because she knew this is where it could happen. We all know of Linda's co-chairing of the first Future of Nursing report that today remains a valuable part of her nursing history. I want you to know Linda always quoted a statement of the late Congressman Bill Clay from the great state of Missouri, for all of you from Missouri. Linda often used and moved and massaged what he said. If you ever remember what he said, there are no permanent friends, there are no permanent enemies, but there will always be permanent interests. And Linda's interest was in moving this profession forward, and felt that she could do this well through the Academy of Nursing. Linda never saw that receiving the many honorary doctorates and the accolades, her election to the becoming an elected member of the National Academy of Medicine, her leadership roles at Civitas Sinai, her leadership at AONL, the National Black Nurses, her board tenure on Robert Wood Johnson Foundation, the National Black Nurses, and her Academy presidency, which was so endearing to Linda, my dear friend. So I say to you, Linda left a legacy. She felt so strongly about the Academy of Nursing. She felt that so much could happen here, and that's why she gave so generously to this organization. So I said to you, she always wanted to call the circle, and I'm calling the circle tonight on behalf of Linda Burns Bolton. And this is the legacy of inclusion, philanthropy, and human caring that she was so forceful in putting forward. May she rest in power, and may her legacy remain in this organization.
Thank you, Dr. Georges. While Janine Rivet and Mr. Erin Mishhan, Executive Director of the Alex and Rita Hillman Foundation, are not able to be here in person, I do want to acknowledge their generosity. Ms. Rivet served on the Development Committee from 2022 to 2024. She understands the importance of leading by example when it comes to philanthropy. For the past several years, she has co-hosted the Minnesota FAAN delegation, and last year discussed the role of philanthropy as an Academy member. I would also like to thank the Alex and Rita Hillman Foundation, whose mission is to improve the lives of all patients, families, and communities through nursing-driven innovation. The foundation's focus aligns with the Academy's mission and vision of improving health and achieving health equity. Mr. Mishhan, an honorary fellow of the Academy, was inspired by the Academy's Science Adds Value for Everyone campaign to support nursing science and decided to give an additional gift of $10,000 from the foundation to this effort. Finally, I would like to extend a heartfelt thanks to all donors who have given in 2025, as well as to those who have supported the Academy throughout its history. Your generosity sustains our mission and ensures that together we continue to advance policy, science, innovation, and leadership towards our vision, healthy lives for all people. Thank you. Now, as we begin one of the most revered events the Academy is honored to host. On behalf of the Board of Directors, we are thrilled to begin our Living Legends and Annual Awards ceremony. The greatness of the profession is seen in the small and quiet actions that occur daily and have an impact in the moment, but can ripple across a lifespan. Tonight, I have the privilege of helping to honor nurses whose consistent actions have led to remarkable impacts and lasting legacies. For these awardees and living legends, they have made it their personal mission to change care practices, design innovative models of care, and advocate for policy change at every turn. They are not just heroes in our eyes, but to countless named and unnamed individuals who have benefited from their dedication, heart, and resilience. The ability to recognize these incredible individuals in such a special way would not be possible without the generous support of our sponsors. Deep appreciation is extended to Cedars-Sinai for their investment in tonight's event. Their generosity allows us to share with the larger community that nursing knowledge is key to improving healthcare systems and achieving health equity. Tonight, we begin by honoring the Academy's 2025 award winners. It is my privilege to introduce the first awardee of the evening, Dr. Sean Clarke, recipient of this year's Civitas Award. This award recognizes an individual who exemplifies extraordinary dedication to excellence in promoting quality care. Dr. Clarke, a health policy and outcomes researcher and transformative leader, has explored workforce issues, occupational safety of nurses, and the influences of economic and political factors on healthcare delivery and the nursing profession. Dr. Clarke currently holds the Ursula Springer Professorship in Nursing Leadership at New York University's Rory Myers College of Nursing and is the editor-in-chief of the Academy's official journal, Nursing Outlook. As a forerunner in patient safety and a prolific author to ensure evidence is brought to the point of care delivery, Dr. Clarke has authored or co-authored over 170 articles and 35 book chapters. Yes, I think we should clap for that. Dr. Clarke has lent his expertise to clinicians, leaders, professional associations, policymakers, and regulators, both locally and globally, having offered his guidance to the Ministry of Health in France and the Ontario Ministry of Health and Long-Term Care. Dr. Clarke is currently co-principal investigator of Towards Magnet 3.0, a multi-method evaluation of the current magnet recognition program supported by the American Nurses Credentialing Center, and principal investigator of the evaluation of the Mother Cabrini Health Foundation's Nursing Initiative, which is providing $50 million in special funding and resources to hospitals in New York State to address nursing workforce challenges from 2025 to 2030. In a recent editorial in which Dr. Clarke reflected on the number of challenges facing the nursing profession, he said, "We can only hope that the promise of better and more cost-effective health care for our clients, as well as more satisfying careers in nursing, will offset the inevitable discomfort that will accompany these shifts," referencing the rapidly evolving healthcare environment and the economic drivers within it. Dr. Clarke is a visionary and a realist whose work will translate to the promotion of better, more cost-effective health care. Dr. Clarke, please accept this award for your invaluable impact to healthcare excellence.
Good evening. I would first like to thank the Academy and its board for this amazing recognition. To join past recipients of this illustrious award and to share a stage with honorees tonight who are all true legends in the field feels unbelievable to me. Over the course of my career, I've been so fortunate to have been associated with not just one, but many amazing institutions and organizations, and to have worked side by side with so many inspiring and talented people who have guided me, walked with me, and showed me so much kindness, generosity, and patience. I try my best every day to pay forward all the opportunities and support they have given me, but I recognize that I will probably never get all the way there. These mentors, friends, colleagues, and students each own a piece of this award, as does my family. I'd like to give a special shout out to my colleagues and our deans, past and present, at New York University for providing me with such a nurturing home base in the heart of one of the greatest, most diverse and vibrant cities on the planet, if not the galaxy. And I'd like to tip my hat, yes, New York. And I'd like to tip my hat to my extraordinary, hardworking, brilliant and kind colleagues at Nursing Outlook, Julie Sneathan, Kristen Geely, and Don Nolan, who make it possible to juggle managing a top journal, the Academy's journal, with a full plate of other involvements, as well as the wonderful authors who entrust us with their work and reviewers who help us put out insightful and provocative scholarship year after year. At this point in my career, with considerably more behind me than in front of me, I still believe firmly in two things. One, that we're going to need even more rigorous thinking, brave and clear communication, and deep compassion for each other to get through what promises to be a very long and rough path in healthcare around the world in the coming years. And two, that the brightest moments of our profession's already exceptional service to the public and to a better and fairer healthcare system are still yet to come. It's our job to keep doing the work, writing the stories, and getting the next generations of clinicians, researchers, and leaders ready to make those moments happen. Happy as well, we hope. Thank you so much for this tremendously meaningful honor.
Thank you, Sean, for your devotion to envisioning a better future for care delivery. Now, I am privileged to recognize tonight's recipient of the Academy's Healthcare Leader Award. This award honors an influential national leader dedicated to improving the health of the nation through contributions to organizational excellence. I am pleased to bestow Brenda Nevidjon with this year's Healthcare Leader Award. Dr. Nevidjon is known to be an originator through a pioneering career of first. This includes developing and managing the first dedicated oncology unit at Duke Hospital, forging the clinical nurse specialist role at the Cancer Control Agency of British Columbia, serving as the first service line manager at Providence Medical Center in Seattle, and the first nurse and first woman to be named Chief Operating Officer of Duke University Hospital. Currently, Ms. Nevidjon is the Chief Executive Officer of the Oncology Nursing Society and its affiliated corporations, the Oncology Nursing Foundation and the Oncology Nursing Certification Corporation. She is also Clinical Professor Emeritus at the Duke University School of Nursing. As an esteemed innovator, Ms. Nevidjon is globally recognized for her leadership of nonprofit organizations, implementing cutting-edge nursing practice models, and advocating for policy that promotes health equity across the continuum of care. She is sought after for her expertise, having served on the National Cancer Policy Forum of the National Academies of Science, Engineering, and Medicine, and their roundtable on quality care for people with serious illness. Ms. Nevidjon supported the Cancer Moonshot Initiative led by then Vice President Biden, and then later served on the Biden's Foundation Moonshot Patient Navigation Task Force. A mentor and champion of the profession, Ms. Nevidjon was once quoted as saying, "Each generation of nurses is the harvest of their teachers, preceptors, leaders, and colleagues, and they are also the seeds for the next generation." Brenda, I am proud to recognize you and your impressive leadership through this award.
And get your steps in coming up that ramp. Thank you, President Scott and the Board of Directors of the American Academy of Nursing for honoring me with this award. And it's also wonderful to be sharing the moment with the other esteemed colleagues that we're recognizing tonight. The teenage me, watching my cousin, who was a little bit older than me, graduate from a hospital diploma program at home, never would have thought that 5 decades plus later, I would have had the career as a nurse that I've had. Some of you may be familiar with Dr. Seuss's book, Oh, the Places You'll Go. That would have been a book back then that maybe I would have read and taken to heart, but I've given it to a lot of people subsequently. I am grateful to so many people in my 5 decades. They gave me opportunities, saw something in me that maybe I didn't see in myself and say, try it. They mentored me, and colleagues supported me, many who are in this room, along the way. And the different paths I had, I've always tried to tell young people that you enter nursing in a certain way, but the many doors and the paths you can go on are endless. I'm especially grateful to my career partner, my husband, who has been with me for most of the 5 decades and has been really good at grounding me through more than one tumultuous period in my career when I wasn't sure that I was really meant to be doing what I was doing. I've worked with many outstanding teams of leaders, and I do pride myself on being able to see talent and to give them the encouragement to join me in being part of a leadership team and grow. I have at the Oncology Nursing Society Enterprise, as I am ending my career in December, an exceptional team. They represent something that an executive assistant when I was the COO at Duke gave me. It's a rock about this big, and on it is engraved Ripple, because she wanted me to always remember my purpose, as we often talked about. And that was to bring diversely talented people together, not just nurses, but diversely talented people together to lead organizations with me, to give them space to grow and to create the ripples that will extend far beyond me and eventually beyond them. Thank you again, Academy, for this incredible award. I so appreciate it. And thank you to all of you in the room who have been with me at different points in my career. It's been very special, and it's wonderful to be here with you tonight.
Thank you, Brenda, for your dedication to the Academy and to the organizations you serve. I am now honored to recognize tonight's Lifetime Legacy Award recipient, Dr. Ada Sue Hinshaw. The Lifetime Legacy Award recognizes extraordinary individuals who have dedicated their life to advocating for positive health system changes. A vanguard of excellence, Dr. Hinshaw's name is synonymous with evidence in action. Over the course of her illustrious career, she has been a trusted public servant, a brilliant researcher, a health policy innovator, and a tireless mentor. This year, we have the honor of celebrating the 40th anniversary of the National Institute of Nursing Research. And as you all know so well, Dr. Hinshaw was its first director. Through the courageous leadership and vision of her and her colleagues to establish the National Center for Nursing Research, through congressional approval, and later its establishment as an institute having equal footing in NIH, is nothing short of remarkable. During her tenure as NINR director, she established the first intramural research program focused on aging, and federal funding for NINR increased from $20 million to more than $50 million. Dr. Hinshaw is a champion for research and research training in many areas of nursing science, such as disease prevention, health promotion, acute and chronic illness, and others. As the Academy faced its collective work within and outside the nursing community to save vital federal dollars to the scientific enterprise. Dr. Hinshaw was the first call we made. And as our CEO, Suzanne Miyamoto, shared with me, Ada Sue has been on her speed dial ever since. After her time at NINR, Dr. Hinshaw went on to serve as Dean of the University of Michigan's School of Nursing and the Uniformed Services University Daniel K. Inouye Graduate School of Nursing, mentoring countless students, faculty, and serving as a consultant to policy leaders and professional societies. Dr. Hinshaw is a visionary in every sense of the word, and her impact is not one legacy, but a lifetime of them. Ada Sue, thank you on behalf of all of us for remaining forever committed to the science our world desperately needs.
This evening is indeed an exciting and privileged moment. I'm being given an award for something that I've loved doing. I've had a career journey in nursing research and nursing science, and that from the moment I took my first course, graduate course in nursing research, I knew was going to be my focal point. I loved it. I loved the creativity, the process of discovery, loved even the logical reasoning and the grinding out of data, which we're all familiar with. But all led to the important opportunity and possibility that we would have information that would allow us to change patient care, to improve health care, and particularly for those individuals, families, and communities that we serve. I must admit that a month ago, I had the opportunity to attend the 40th anniversary of the NINR. That was a very exciting moment. Brought back a flood of memories, as you can imagine, having been there in the very first early days. And in those early days, we had a major dilemma. We were faced with the entire field of nursing and the question of, where do we start? Where are our best opportunities to build focal points and to essentially role model how to build focal points for our science in the years to come? And we turned immediately to the nursing community. And we asked 50 nurse scientists that day to come and to work with us to be able to provide research priorities that would tell us where to start. And that group was phenomenal, as you guys have always been phenomenal. And they came up with 7 priority areas that guided the first 7 years of the research focal point research that we provided funds and budget for. Very exciting, everything from prevention of low birth weight infancy to health promotion to managing chronic conditions for the elders and their families. So it spanned quite a bit of that field that I spoke of earlier in terms of nursing research. And those have only continued to become more detailed. At the 40th anniversary, I was so struck by the sophistication of our science, how far we have come. Having been there in the beginning, I could tell the degree of sophistication of the methodologies, the degree of the sophistication of the theories, the knowledge that have been built. And so tonight, I want to take this opportunity to thank you who are in the audience, the nursing community, particularly our nurse scholars and our nurse scientists, for literally fulfilling the promise, that early promise, of what nursing research could be and what nursing science will be. That's an evolving process, as we all know, but very exciting, and we could all be very proud. Give yourself a hand. I want to take just a few minutes to say a personal word of thanks as well. I've not done this career journey alone. I've done it primarily with two individuals who have given me strength and support and kept me grounded. And that is my daughter, Cynthia Stark, and my son, Scott Hinshaw. They are both here tonight. Thank you.
Ada Sue. Okay, not only am I getting steps in, I'm getting a little bit of jogging in. Thank you, Ada Sue, for your commitment to the Academy and our vision of healthy lives for all people. Before we conclude this evening's award presentations and begin the Living Legends festivities, it is my pleasure to recognize Dr. Kenya Beard as the Mary Elizabeth Carnegie Leadership Award recipient. The Mary Elizabeth Carnegie Leadership Award recognizes a fellow whose significant and sustained contributions have advanced the organization's core values of equity, diversity, and inclusivity in nursing and healthcare. Dr. Beard is a nationally recognized leader in health, equity, policy, and nursing education. Rooted in her deep commitment to justice, she has spent her career building inclusive pathways to improve care outcomes and systems. Currently, she serves as the inaugural Dean and Chief Nursing Officer at Mercy University School of Nursing. As an advocate, skilled communicator, and forerunner for identifying strategies for success, Dr. Beard has served as a senior fellow at the George Washington University School of Nursing's Center for Health Policy and Media Engagement, and has co-produced healthcare disparities segments on WBAI-FM, reaching more than 400,000 listeners. Lending her expertise to formidable policy bodies, Dr. Beard has supported the work of the National Academy of Medicine, and in particular, the Future of Nursing 2020-2030 report. She was a co-author on the report, Racism in Nursing, as a commissioner for the National Commission to Add Racism in Nursing. Her influence, presence, and passion led her to be featured in Everybody's Work, Healing What Hurts Us All, a landmark documentary that confronts the enduring harms of racism and showcases how nurses are driving transformative change nationwide. As a previous chair of the Academy's EDI committee, member of the Academy's Institute for Nursing Leadership's National Advisory Council, and co-founder of the National Black Nurses Association Academy of Diversity Leaders in Nursing, Dr. Beard is a valiant leader whose poise, clarity of thought, and leadership gravitas makes her message resonate and reverberate. Kenya, thank you for your unending grace and leadership.
What an honor. Thank you, Dr. Scott, Dr. Miyamoto, the Academy for this extraordinary honor. To receive the Mary Elizabeth Carnegie Award is profoundly humbling. Dr. Carnegie was a courageous leader who dismantled barriers and created pathways for African American nurses to be seen, heard, and valued. Indeed, I am here today because of the life she led. She overcame obstacles that I can't even imagine. And some of you know that this year has been incredibly difficult for me and painful. I suffered a horrific loss, a loss that threatened to send me into a deep spiral. But I had colleagues like Dr. Daniel McCamey and Danica Sumter, who reminded me that it's okay to pause, step back, cry, and reset. And Doctors Ashley Graham-Perrell and Angela Amar, they introduced me to the tremendous healing power of gratitude. So tonight I am beyond grateful, not just for this award, but for the mentors who, just like Dr. Carnegie, knocked down doors and influenced my path when I was just me, before I became Dr. Kenya Beard. I never shared this with anyone before, but first, it was Dr. Diana Mason who saw me, and she began to open doors in ways that influenced my trajectory. She then introduced me to Dr. Beverly Malone, who modeled for just me how to own my space and lead with conviction. Then I met Doctors Frida Outlaw and Renitha Julian, who taught me, just me, how to shape my ideas into powerful narratives. And Barbara Glickstein taught me how to master the art of interviewing to inspire change. You see, early on, I didn't know if I could do this work. But then God sent me Dr. Janice Brewington, whose innovative spirit sent subliminal messages that awakened my understanding of authentic leadership. And then I met Dr. Virginia Adams, who illuminated the meaning of DEI through her 1950s lens, and she helped me tuck my fears beneath the gravity of my purpose. But when doubt crept in, God sent me Dr. Deborah Barksdale, who gave me the tools to advance as a courageous leader. She also gave me my first executive coach. And then I met Dr. Sheldon Fields. He reminded me that perseverance is not an act. It's an art that requires chess-like moves. I watched Dr. Ernest Grant, the epitome of courage. He showed me how to stand unflinching like Daniel in the lion's den. And then Doctors Rumeh Alexander and Barbara Nichols emboldened me to do what I was put here to do. And Dr. Katie Boston Leary whispered in my ear, "Stay fabulous no matter what." And to my B squad over there, my incredible husband, Ron, of 40+ years, who truly knows the just me inside of Dr. Kenya Beard. Thank you for loving and leading me through this journey called life. I will follow you to the moon and the stars above. My daughter, Talia, the Eagle Eyes contract lawyer who put the G in gratitude, she makes me a better person every day. And my son, with his 1 million followers, who reminds me what influence and humility looks like every single day. Together, they give me the strength to press on, So I thank my B Squad. And in closing, I accept this award on behalf of my nephew, who's no longer here, but here in spirit, my family, mentors, and colleagues who touched my life in some special way and helped me become the Kenya Beard that was up there. I appreciate you all, and remember, inside of Dr. Beard is just me, who is forever grateful to Dr. Carnegie and the Academy. Thank you so much.